So this section is about the drop arm test that's commonly used for rotator cuff tears. And so what we're looking at is the ability of the person, shown here, to hold the arm either above 90 degrees or below. Typically the way the test is performed is the person's asked, the person's arm is raised up above 90 degrees, and then the person's asked to lower it on their own. If the test is positive, they'll be able to navigate the first 20 or 30 degrees of motion and control the lowering of the arm. But somewhere near around 90 degrees, the mechanics of the arm break down, and instead of controlling it, the arm drops to the side. And that's seen or illustrated pretty well in this short 30-second YouTube video of an older patient with a rotator cuff tear. So what we want to do is understand some of the biomechanics that are occurring during the drop arm test and what explains that. So I've drawn two diagrams here. One is the internal moment acting into abduction below 90 degrees at 60 degrees of abduction, and then the same internal moment of muscle forces acting at above 90 degrees or at 120 degrees of abduction. And the muscles are labeled here. The FD will be the deltoid, F of S will be the supraspinatus, and the FRC will be the other rotator cuff muscles, the subscapularis and infraspinatus in this case. So we can see here that, first of all, that when we look at a 60-degree position, the first thing we want to focus on is the glenoid. The glenoid isn't necessarily straight or vertical. It's been rotated because it moves with scapular rotation. So there's been some upward rotation of the scapula. And since the rhythm's 2-to-1, there's been about 20 degrees of upward rotation of the scapula and 40 degrees of glenohumeral abduction. So we can see this here now, the way that this works out. And what's interesting is that in this particular case, we can see that the force in the deltoid is going to abduct. We know the perpendicular component will rotate the segment, but we also know that the cosine or of FD 15 degrees, or the forces acting parallel to the segment, are going to translate the segment superiorly. And this superior force along parallel to the segment from the deltoid is typically counteracted by the force in the supraspinatus and the rotator cuff muscles, because we can see how the rotator cuff muscles here have a downward directed force. So when this force couple is in place and the force of the deltoid doesn't have to be as large to abduct the arm, the superior force of the deltoid can be negated, and the person can easily control the lowering of their arm under 90 degrees. But when the supraspinatus is absent, what happens is the force in the deltoid has to go up, which also increases this superior force, and the other rotator cuff muscles aren't able to stop that from occurring. So how's that different than the shoulder abduction position above 120 degrees? Well, now we've changed the position of both the glenoid and the humerus, and we can see that now, because of the scapulohumeral rhythm, which is 2-to-1, that we have about 80 degrees of glenohumeral abduction that's moved as on the upwardly rotated scapula that's rotated about 40 degrees. And we can look at the lines of actions now, especially of the deltoid, and we can see that the superior force that we saw under 90 degrees is now actually this cosine of the FD, this force directed this way, is now more effectively compressing or driving the humerus into the surface of the glenoid, and is no longer dislocating the shoulder. So above 90 degrees, if we don't have the supraspinatus force, what we also, it's okay, because the deltoid force isn't causing a superior subluxation. Rather, it's causing a compression at the glenohumeral joint.